Hi, everyone. This is Susanna Niffen with Children Now, and we just want to say a huge thank you to everyone for joining in today for this webinar. We are thankful to all of you who regularly attend the Child Welfare Policy Roundtables that we hold in the state capitol. As you know, with everything going on right now, we were not able to have that meeting today, but we are incredibly grateful to the John Burton Advocates for Youth, as well as all of the other coalition partners who have pulled together to put on an amazing webinar for you today. And I will turn it over to Anna to get us going.
Great, good morning. And can people, Susanna, before you mute yourself, can you see the screen okay?
I cannot. Oh, there we go.
Okay, I'm gonna, okay.
Yes, I can.
Great, okay, so good morning, everyone. Thank you so much for joining us today. I would like to share some logistics before we get started. First, you can download today's slides and the full Child Welfare Advocates COVID-19 response letter using your control panel. As we move through the presentation, please submit your questions into the questions section of the control panel and click send. If you have comments, feel free to type them in as well, as I can read those to the audience if there is time at the end. So we will post today's recording on our website and on YouTube, and you'll be able to access all of the materials on our website after the webinar today. So again, please feel free to take a moment now to download the handouts. Again, they're in the handouts portion. There is the PowerPoint. All of the links are active. Our agenda is fairly direct. We will give some updates as the COVID-19 coronavirus pandemic and the impact felt by youth, caregivers, and counties during this time. Then we'll review youth rights and how to uphold those during a pandemic. We'll walk through each recommendation from the letter with any updates we have heard since it was submitted last week. Then we'll go over existing COVID-19 resource pages, state and federal guidance, and ask you to sign on in support of our letter. We will follow this up with a question and answer session. So as of last night, the U.S. was nearing 250,000 confirmed cases of novel coronavirus. California's shelter-in-place order is in place to slow the spread of the virus, with many areas extending the shelter-in-place order with additional restrictions through the month of April. California is home to the largest child welfare system that relies heavily on the public services, schools that are closed, limited, or provided virtually right now. Emergency response efforts specific to the needs of our youth, families, caregivers, and providers, and our workers are critically needed. Without clear direction of emergency relief and guidance, our children and youth will be left behind. We have seen the devastating results of overlooking the needs of children and youth in response to disasters and emergencies in the past. And we actually have an opportunity today to steer the course of their futures. It is critical that the state of California act swiftly and responsibly to address these urgent needs. Jen Rexroad of the California Alliance of Caregivers will share more now about direct relief and the needs of caregivers.
Good morning. I just want to say quickly a big thank you to Anna, who has done an amazing job of coordinating child welfare advocates who've had many phone calls with many of you this week, and it's really organized advocates to come together with a combined ask and to kind of organize everything that's needed and the response to help vulnerable children and families. And that's really been a bright light for me this week. So thank you very much. And I'm going to talk about the reality for resource families right now. As you know, all families are facing hardships, and this pandemic is really especially complicated for families who are fostering. And in fact, this morning in my county, as I'm a foster parent, I received a text for a placement needed for a 15-year-old male. And I was thinking to myself, oh my goodness, you know, who's going to take this poor kid? And lo and behold, about, I don't know, 10 minutes later, I get a text that they found placement. So that's just really amazing that families are taking placement right now, even with, you know, the potential risk of exposure. The first item that, or first point I want to talk about is that many of our resource parents are relatives. About 40% of children are placed in relative homes, and many of these caregivers are seniors and or medically fragile. Many foster children and youth are also medically fragile or have pre-existing health conditions, including many who've been prenatally exposed. And this makes them particularly vulnerable to potential exposure. And so for many of these families, they're not able to go out to stores to purchase groceries or to pick up school breakfasts and lunches, you know, if they are available in the community. And so there are additional costs to keeping these families safe. Also, we know that all families are now educating, entertaining, supervising, and in some cases isolating children or parts of the family to meet all the needs of children in care. And this is obviously happening 24/7 without the supports that are normally available to families by school districts. And that includes oftentimes breakfast and lunch, and sometimes a third meal or snack, and other special ed services, therapy, respite. It's been particularly hard on families who have children with special needs, and for example, who are parenting a child with autism, who normally has a lot of support. And these families are really feeling the strain. Getting out of the house for anything, even to go to the grocery store, is often a huge hardship. So there are a number of additional expenses for these families that are not covered in the basic foster care rate. So our recommendation to increase the base rate for all children in foster family, agency families, or county families, for the infant supplement rate and for SILP placements is to address these additional costs that are usually absorbed by other parts of the safety net, or additional costs that this pandemic has brought to families. And now I'm going to turn it over to Erica Hickey.
Yeah, hi you guys. So we have 4 bullet points up here: housing, wellness, employment, and education. So I would hope that you can just look at these bullet points and really just listen to what I'm gonna have to share right now. So when I was talking to young people, more so in the Greater Bay Area and within the Inner Bay Area, I was asking them what their immediate needs were right now, because when COVID-19 came out, the coronavirus, a lot of instabilities that were more so daily, so making sure that they were going to shelters at 8 p.m. when they opened up and getting a place there now are becoming more transparent, and things are being more highlighted, I would say. So as far as housing, I was actually talking to some peer advocates themselves and seeing what their young people's immediate needs were. And the thing that came up was the fact that a lot of young people that are currently trying to get into housing, specifically like transitional housing programs, there are vacancies within those transitional housing programs, and there are multiple issues that come with that reasoning, and it more so has to do with the fact that a lot of employees that were originally supporting young people in that transition to move in have taken time off because of COVID or have quit entirely. So there's a lack of employment when there's trying to get transitional housing and having them move in. The other thing is just young people don't have the means to hold these meetings. So what I mean by that is they don't have a phone to schedule these meetings that could have been face-to-face that no longer are, and that's covered by a meeting on the phone, but they don't have phones sometimes to actually make these meetings, which makes it 10 times more difficult for them, which leaves them on the streets. Following that, there are also shelters that are closed that aren't letting other people in, even though there are vacancies there as well. So yeah, housing in Alameda is open, and they are funneling young people from Covenant House to their site. And they are now open at 4 p.m. instead of 8 p.m. as they usually would be, and they can hold up to 25 youth, and they only have 9 right now, and they're screening for COVID before entry, but the issue with that is they aren't actually testing. They don't have the means to do that. Same thing goes with other youth shelters. They can only screen and ask basic questions on if someone has symptoms, but they don't have the means to actually test. Another thing is with employment, young people that have been in these shelters and in transitional housing programs, they actually are being laid off right now due to budget cuts. And so just helping them explore the ideas of unemployment and just how to educate themselves with stuff like that when it comes up are some things that they need support in. And then education, a lot of young people are used to using resources on campus. So our young people that are focusing on higher education, and they'll usually go to the libraries or just anywhere on campus that provides them with technological support. The issues with that is now they're closed and they're forced to stay at home while continuing their higher education. The issues with that are that they don't have the means to do that. So they don't have a laptop or a cell phone or both. And so I understand that some districts are actually trying to foot that bill and figure out what's going on and figure out how to get those hotspots for young people. I know Google is doing that for California in general, doing hotspots, but there's still a major need within our population and the child welfare system for those things. And then lastly, wellness. I know that young people have expressed that their usual routines are definitely changing because of the lack in services, and they're used to face-to-face therapy sessions. And then also understanding that childhood trauma is being brought back up with this COVID crisis, especially with just trying to keep in touch with people, understanding that there is a crisis. So a lot of PTSD is coming back, some anxiety. Seeing empty shelves in the grocery stores after they've sat on a bus for at least 2 hours per grocery store because each of them is empty. So that spends a lot of their money and their day trying to get resources. So a lot of peer advocates in the Bay Area have actually created food bags to meet the immediate needs of young people with perishable items and dropping it off to where they are staying. And that's actually helped a lot of them, at least in Contra Costa, San Francisco, and Alameda. And I believe that is it as far as young people have shared with me. So I'm going to toss it on over to Rochelle to talk about youth rights.
Thanks, Erica. Just want to say thank you to all the folks that are joining us and all the people that are doing really hard work 24/7 across the state to ensure the safety and well-being of foster youth and their caregivers. Today I'm going to just briefly talk about the intersection of foster youth rights in this era of COVID. As Erica stated, technology has never been more important than it is now in the context of child welfare and foster youth. I think that we can't operate without ensuring that every house that has a foster child has the internet and a phone or computer to be able to communicate. And so with that, I'll say that there's iFoster is doing a really incredible job making sure that youth ages 13 to 26 can get cell phones for free. And those cell phones have free talk, free text, and free data. And Boost Mobile just recently increased their data limits to 20 gigabytes to make sure that youth have the ability to participate in school, to participate in visitation via, Skype and other video conferencing technologies, to be able to talk to their social workers and their attorneys, and also just to stay connected to their friends and loved ones, and especially in this time of isolation, that's never been more important. So I think that from the perspective of our office and foster youth rights, thankfully in January of this year, a new Bill of Rights went into effect that gave young people in foster care the right to use the internet and computer technology consistent with their age and maturity, and also to be able to use electronic communication methods. And so I think the opportunity that we have right now is to really work with the different agencies to make sure that we're asking every single caregiver what their needs are, to ensure that young people have this access and to ensure caregivers have this access. I anticipate in the coming days that the Department of Social Services will be releasing some guidance to help expedite counties to be able to share information with iFoster about the young people within their jurisdictions so that we can get those phones out. And then some additional work to get laptops to young people who are in need. So I think we have to just continue to be creative and ensure that access is made available to every child and caregiver in California. And with that, our office is also now operating 7 days a week. We're keeping our hotline open. That number is, I'll say it on the phone twice, but I'll also ask if Anna could send it out after. But that hotline is 877-846-1602. I'll say it one more time, 877-846-1602. 8 to 5, 7 days a week. We're happy to try and triage and respond expeditiously to caregiver and youth concerns as they come in, and partner with counties and agencies to act to best meet the needs of all youth in California. And our Foster Youth Help website is up and live. We have some COVID information there. We have some tips for caregivers around talking to children about what's happening. We have the iFoster application and frequently asked questions on our website, and we'll continue to update and post daily as things change and come in. So just invite all of you to reach out to us, and if we can be of help, we're happy to do so. So thank you for allowing me to participate today. And now I will turn it over to Diana Boyer, CWDA.
Thanks, Rochelle. And wow, thank you for being open 7 days a week. You and your staff are incredible resources to the foster care community. Thank you, John Burton Advocates and others for putting this on and for allowing us to present and share today. For the county child welfare side, we are very concerned around the needs of our families, our youth, children, and what this means now and what this means for the future. This is unlike anything we've ever, obviously, any of us have gone through. So in many ways, this is going to be new territory, and something that we'll be dealing with for months ahead, unfortunately. We, however, will always, our county agencies, continue to prioritize child safety. For that reason, you will see that all 58 counties continue to operate, staff, and prioritize any calls that come into our child welfare hotlines. Child safety is paramount. We don't take that job lightly, and if there are ever any reductions in staffs or resources, those hotlines will continue to answer those calls from families or concerned mandated reporters to ensure that we're investigating and seeing children and ensuring their child safety. We have been partnering with our State Department of Social Services to try to ensure that there's guidance to counties so that we are doing things somewhat uniformly across the state. You will find differences here and there on some approaches I'll talk about a little bit later, but the hotline response is still an in-person response. Certainly we are asking the relevant questions with respect to if there might be some risk factors going into the homes, maintaining social distancing whenever possible, etc. CDSS continues to issue guidelines to the counties. So for those that are interested, you can go to the CDSS website. Under their policies tab, there's an all county letters list where they're posting their relevant information and guidelines. So far, ACL 2028 was recently released, and that does address the emergency response requirements. Everything else has really gone towards a remote function to the extent possible, because we want to protect our staff, make sure that they continue to do the work, and also, and importantly, to protect the families. As Jen mentioned earlier, 40% of our caregivers are relative caregivers. And, those sometimes caregivers are older, they may have their own underlying conditions that puts them at risk. And we want to make sure that they're absolutely as safe as possible so that they can continue to care for children. So there is another ACL that was released, ACL 2025, that also addresses visitation. And that really does allow counties to go to a more virtual way of doing our monthly in-home visits. It is video conferencing, so we still have eyes on children. It does not give us a pass. If we think there's a safety concern, we will still go into the home if we believe we need to check on the child in person. There's lots of concerns. I know you all have concerns. We have a lot of concerns. One of the biggest concerns is the significant drop in our referral rates. This is basically a nationwide problem. It's not unique to California. And many places have dropped significantly. I was on a conference call with LA the other day, and they indicated that their daily call volume dropped from 1,000 calls a day to 400 calls a day. And that is somewhat to be expected because our mandated reporters are not seeing kids. As kids are in school, out of school, they're out of childcare, the healthcare providers aren't seeing them in visits, office visits. It makes sense, but it's something that we're very greatly concerned about. We recognize the difficulty that resource families have been put into based on the fact that they have their kids all day, they're not at school, they don't have respite, there's additional costs. So that's something that we're very mindful of. We're also concerned about families and children that were on a path towards reunification. Lots of local organizations, for example, those that were doing substance abuse treatment and counseling, domestic violence shelters, many that have closed their doors and put into question the pathway towards reunification for families. This is heightened by the fact that many courts have issued orders that have essentially closed their doors to any hearings other than emergency detention hearings. Of course, we're also concerned about our non-minor dependents and transition age youth. It's called into question their ability to gain employment, continue in schools, and et cetera. The biggest thing that we've heard from non-minor dependents has been housing. Housing has been a huge need and issue area for them, and our counties are scrambling to ensure that they can connect those youth to viable housing options. One other area of concern is around our staffing. Our own staff have concerns about continuing to enter into homes without personal protective equipment. In many counties, it is a struggle to even get Purell sanitizer, let alone any masks or gloves or whatnot. We have to also consider the fact that some staff themselves may not be fully able to work because of their own childcare issues or family issues or their own healthcare needs. So we're trying to manage the staffing issue locally as well. For the most part, we do have most county staff staffing at full levels with only some minor issues so far. Hopefully it stays that way. Some of the strengths that we're seeing in counties are really locally driven and homegrown at this point, and we would hope that at some point we see a statewide leadership around this area. But certainly one thing is embracing technology. So I think we all are very familiar with Zoom, WebEx, Skyping, whatever the case may be. Counties are fully utilizing those technological solutions. In addition, most county staff can work remotely. The state has ramped up the ability to access our online systems remotely, so that's great. And then we're also seeing some local partnerships. So for example, in the case of the reduction and referral, San Francisco is looking at partnering with their Child Abuse Prevention Council, their Family Resource Center, and even their school district to make calls or visits with social distancing on some of the families that they've worked with, that they have some relationship with, or just those families that they may have a concern about, just to kind of do a check-in to make sure that everything's okay. Fresno County is looking at doing a partnership with their local CBOs to keep them propped up. One of the things we've heard is that with local community-based organizations that we normally partner with to provide services, if they're not able to bill for those services, they are at risk of going under. So they're looking at a local solution there. Another big area of concern has been what happens if a child is sick and potentially needs to be in a quarantine place that is not at the home. For example, if the caregiver is at risk or if there is a medically fragile child. And LA County is looking at partnering with Airbnb to find homes or vacant properties that they could use to be an alternative home caregiving environment. So one of the things that we've identified is really just a lot of need of a flexibility for our work. Whatever we can do to do more virtual visits, those are the things that we're hoping we could accomplish. Funding is a really big need in multiple areas, especially getting more money into the hands of caregivers. And just resources, like the ability to ensure that our caregivers and our youth are able to access online mental health services. So with that, I'll turn it over to I think it's Anna, who's going to be sharing our recommendations for the group.
Thank you, Diana, so much for all of that information that you just provided. So as you all heard, California has a strong community of caregivers, 40% of whom are relatives and are more than twice as likely to be living at or below the federal poverty level than non-relatives. These caregivers are facing new challenges, as you heard from Jen Rexroth, in the face of the coronavirus pandemic. Many of our caregivers and our young people have lost their jobs already or had hours reduced, while others will require more child care due to school closures or continuing to be essential workers. As you heard from Rochelle, people might be doing extra hours or more hours and covering for other staff who might be sick or need help. Older youth in foster care, age 18 to 21, also face serious challenges from the coronavirus as their hours of employment are reduced, as you've heard from Erica, and the housing needs. It is critical that we support caregivers and young adults in foster care during this time. To do so, we recommend policymakers take the following actions that have been highlighted in our letter. And again, just a reminder, I am assigning questions that people are sending into the control panel to the different speakers for the question and answer session at the end. And the handouts and the letter are there so you can follow along. So again, we are recommending the provision of emergency financial relief to caregivers and youth impacted by coronavirus, which includes increasing the monthly foster care payments across all programs and the infant supplement, establishing a foster youth college relief fund, informing non-minor dependents about the benefits that are available through unemployment, CalFresh, and the stimulus package, and increasing virtual access to food and food supplies in a way that would be safe for our medically fragile populations. So I'm now going to turn it over to back to Jen actually to give more details about our first recommendation.
Okay, so when the foster care rate was created, it obviously did not take into account this type of emergency and additional complications that it's placed on families. And by increasing the foster care payments by $400 per child, it draws down Title IV funding or federal funding to match these dollars. So it's more of a bang for the buck, so to speak. We believe that this is the easiest and most rapid way to get money to families to stabilize placements. And I'm glad that Diana brought up the issue of what happens when someone in the family gets sick. And I know that our family, has a plan which also includes using Airbnb. So there are a lot of additional expenses that are not, that some we know about, some may be coming up, and we don't want to see a rapid decline in placement stability, which has been something that we've been working to address as we're moving more and more youth out of congregate care. It's absolutely critical that we provide stable placements for all children in care, and supporting families in this way very quickly. It's easy to, or relatively easy to add this amount into the foster care rate temporarily. We expect that will be something to stabilize families. In addition, you can imagine that a lot of caregivers do have jobs. They're either losing jobs or they're unable to work at all, so that they don't bring exposure back to the family. Again, especially if they have children who are medically fragile or who have pre-existing conditions, or their hours may be greatly reduced. Their ability to work is reduced due to the childcare that they have to provide. Have I covered everything, Anna? Do you have anything else to add?
No, I think that's it. There was a clarifying question about, do we need, does this cover youth in THP, THP-NMD, or non-minor dependents? And yes, this would be across all placements. There's some other questions that we'll come back to at the end, but for now, I think we can sort of transition on to Debbie. Thank you so much, Jen.
All right, thank you. So I'm going to speak to, if we can go to the next slide, establishing a fund to address the needs of former foster youth who are enrolled in college. So a lot of the recommendations you're going to be hearing about today are specific to the needs of youth youth and children currently in the foster care system. We know that there are also young people who have exited the foster care system who are experiencing serious hardship right now. I was on a call yesterday with some folks from different college campuses, and what they shared was that they're actually getting the students that they serve who are former foster youth are facing more significant challenges than their non-minor dependents. For obvious reasons, the non-minor dependents have access to resources through the foster care system, whereas those who have already exited foster care don't have a lot available to them. So what we're hearing is, the kinds of things you would expect. Many of them have lost their jobs. Many work on campus or in other industries where there's been huge numbers of layoffs. And so they're not able to pay their rent. They're not able to access food. They're not able to address their very sort of most basic needs right now. So what we're proposing is that a fund be established that can be administered through the campus support programs at colleges and universities. We're very fortunate in California that we have a very robust network of foster youth specific campus-based support programs across all of our different sectors, that this would be funding that they could have access to in order to issue emergency funding to address needs like housing, somebody's in imminent loss of housing or has no access to food or other crisis issues. So this would help that population of folks who are no longer in the foster care system, but have significant needs. So that's this recommendation. Happy to take any questions at the end, and I will transition this over next back to Anna.
Thank you, Debbie, and thanks again for everyone sending in questions. I am assigning those to panelists, so keep on typing them in. So our next recommendation in our letter does have to do with the benefits that are available, but our transition age youth, our non-minor dependents who are heavily impacted by coronavirus and the closures from school and work, we have actually heard from many young people that they have lost hours or been laid off. And they've let us know they didn't understand that they would qualify for unemployment having reduced hours. They didn't know how to fill out that process or where to go, what it looks like. These are typical barriers that are already there for transition age youth. And typically to do things like file your taxes, there are real barriers even without a pandemic. So to kind of get over some of these hurdles, let youth know they have more time to fill out their tax credits, let them know about the paid sick and family leave, the expanded unemployment insurance, the ability to benefit from the stimulus payments, any emergency food assistance programs through food banks that are happening, as well as CalFresh, and homelessness relief. These are all out there, but do our young people and caregivers know about them? Not without help and direction. So we are recommending some targeted guidance there. We do know that youth may be more isolated now due to the shelter-in-place orders and lack of technology that Rochelle mentioned earlier. Again, we already know there are barriers, and we have had initial conversations with the Department of Social Services on guidance that could be needed. And again, the supports that would be needed in addition to the guidance, completing the paperwork, filling out the necessary documentation, and saying things correctly. For a normal adult reading the news, it has been very clear, what do I need to tell my student loan borrower? What do I need to tell my landlord? What do I need to say? How do I need to say it? What does proof mean? These are all questions that our young people and caregivers also have. And as they're scrambling for information, reliable information, while also being isolated, it is, I think, on all of us to bring this information to them and help them through this time with that. Our next recommendation is around CalFresh. Transition age youth and our non-minor dependents, again, have been heavily impacted. And we know that they can benefit from CalFresh. There's been a lot of activity here. We did get a number of updates that the state is trying to get federal approval to join a pilot to be able to do online grocery purchasing through Amazon and Walmart. They're looking for more local grocers and others to participate in that pilot. They're trying to waive certain delivery fees. We know that this is important to have delivery options available for our youth who have underlying medical conditions, our caregivers in those high-risk categories. We need groceries, again, as Jen mentioned, with the additional food, and it's not safe for everyone to go out to their school, every school site, and pick up food if they're putting people at risk. So I think to have this option and keep moving this forward, we are all in agreement this is important and are appreciative of all the steps people are taking to make this accessible. We have had a number of questions from students about, I was denied CalFresh before, and so what would be different if I apply again this time? And understanding that some of those, the flexibility that's being granted right now on eligibility and other items is really important to get that message out there. So I think that's kind of, again, I'm happy to answer any questions about what we're hearing around CalFresh, and we just really support getting food resources to our young people and caregivers where they are in the safest way possible right now. So transitioning on to recommendation 2 from the letter, we do know that most traumatic events for youth and children in foster care are part of this unplanned disruptions that cause stability, where they're removed from their home, their family, their school, they're transitioned into another placement. This is already traumatic. Now, coronavirus poses a serious threat to maintaining family and placement stability through multiple increased pressures. Studies show that, again, one of the most traumatic aspects of foster care is that placement instability, and action can be taken now to preserve resource families and providers and maintain placements. So I'm going to turn it over now to Jillian Mccormick from CLC, who will share more about our recommendations now.
Thank you, Anna, and thank you for everyone who is participating in this and all the partners who have worked so hard on coming up with these recommendations. I'm going to speak to our first bullet point under recommendation number 2. As Anna mentioned, and many of us in this community and on this call know, for our non-minor dependents, placement stability is an issue that they have been facing for quite some time. We've been really focused on transitioning or not transitioning our non-minor dependents into homelessness, and with the COVID-19, we're seeing additional pressures. So our first bullet point under this recommendation is a request to place a 180-day moratorium on discharge of any non-minor dependents from extended foster care. We believe this is really important. We've seen with our clients in LA County, youth that are getting ready to turn 21, being asked to leave placements or being provided resources or references to homeless shelters. And clearly that is not what we want to be seeing with our youth. We understand how important placement stability is, especially at this time with the public health risk. And so unless our youth are requesting to be removed from extended foster care, we're asking a moratorium and specifically focusing on the participation requirements. As we know, with a lot of the schools closing, our youth may not be able to participate in online schools, so they're unable to meet the school participation requirement. Also the work participation requirement. Many of our youth, I believe we've already been stated, they're the last hired, first to be let go. So many of our youth are no longer employed through no fault of their own. And we do believe that those participation requirements should be waived during this time so that our youth can remain in their placements and stay stable for at least the next 180 days. So that is the first bullet point under here. And then I'm going to turn it over to Jennifer Rodriguez from the Youth Law Center to speak about the second bullet point.
Thank you. Good morning, everyone. So earlier you heard Jen talk about how families are being impacted, our resource families across the state by this crisis. And I just want to emphasize that it's always true, but couldn't be more urgent right now that families are really our most important intervention and safety net for children and youth who are in care. And right now, we all are relying so much on our families. And for young people who are in care, this is an even more stressful and urgent situation. We might have children and youth who are with families who they literally were placed the day before shelter-in-place orders or have been placed during shelter-in-place orders and are now reliant on their family for education, for healthcare, for everything that other entities might have been providing. And so I think what's really important about thinking about placement stability is we don't have any current barriers in law. And this is not an area that we necessarily need more legislation in, but we do have a number of, as you heard Diana mention earlier, promising practices across the state. I'm the executive director of the Youth Law Center. We have been working with CDSS and counties on the Quality Parenting Initiative now in California for about 10 years. And one of the documents that counties created early on was a partnership plan that requires that caregivers and counties agree that an expectation is that a child will not be disrupted out of a family. There will be no notice given on a child unless it's determined that it's in that child or youth's best interest to move for good reasons, like permanency or to a setting that is more appropriate. So during the last 10 years, we've had a number of counties that have experimented with placement stability strategies that I think the rest of the state needs to figure out how to scale up and resource at this point. And just as a very concrete example, both Ventura County and San Diego County have created peer mentoring and peer resource specialists. And these are experienced resource parents who, in San Diego, there is a 24-hour call line where families can call if they're experiencing any challenges in their home, where they're going to be connected with a very experienced caregiver who can help support them and walk them through and stabilize the situation so that there's not a disruption. And that's a program that San Diego County reports is having approximately 90% success rate in being able to stabilize. So I think that the bottom line right now is that while agencies are stressed and while folks are having a difficult time providing business as usual, we really have to keep our eye on quality and support of families, and in creating creative approaches and looking at strategies that we already know work. Ventura County has had similar success in sending out experienced foster parents. So this is a moment to figure out, do we have resource parents? What would it cost to operate such a program? Are there emergency resources that we could use to scale those up? And this is really important. And I want to just say, also important for non-minor dependents, as well as you heard. Essentially right now, if a placement disrupts, I think we run the risk of having a very, very difficult time finding an alternative placement. And this means that I think many counties are considering, if there's a disruption, congregate care solutions that we know right now are absolutely a disaster from a public health standpoint. There's no way to control outbreaks. There's no way to properly sanitize. You have staff who are coming in and out of facilities daily who are potentially exposing the children in those kind of facilities, including shelters, to illness and to risk. We know that those kind of facilities are also going to be under stress if their staff get ill. So we want to do everything possible to be proactive and to really support children and families to make sure that whenever possible, we can move children to families. And for our non-minor dependents, we want to give them the opportunity to follow the state order to shelter in place and to just stay put with the moratorium. So, and I also want to just highlight that I think the state issued excellent guidance in their all-county letter this week. That's all-county letter 2033. That also clarifies a common question that's coming up around the state around what happens to stability in the event that a child is symptomatic or positive or a caregiver is symptomatic and positive. And just to give you all the quick answer, I recommend you read the letter because it's excellent. It also covers congregate care. But to give you the quick answer, stability is first and foremost protected. So families are asked to do the same thing that the CDC recommends for all families, which is follow guidelines around quarantining in the home and cleaning and isolating children when all possible. But it's really important, I think, for everyone to be familiar with that guidance and to also look, CDSS has been very clear that the most important placement preservation strategy we can have right now is to communicate clearly with families, to be checking in more frequently than what we usually do, and to be identifying any unmet needs that they have and being really creative about what a solution is. Go to the next slide, please. So I want to just transition here into something that was mentioned earlier about how important it is that we are now versatile and creative and flexible. And in particular, right now, we have always, I think, in child welfare had a need to be more creative with our use of technology, but we now have an urgency, really. Technology has now become a utility because our children and families are literally dependent on having access to internet and tech to access telehealth, to be able to visit with family, with siblings, maintain connection with friends, to have safety checks with caseworkers or probation officers, to have contact with their attorney. So what we really need to be looking at now is what are all the system processes that we have and how can we make those really responsive to youth and families, and quick timelines, ability to transition. We already covered technology, but I do want to just emphasize this is not a question of if families should have it, if youth and children should have it. They absolutely need it right now. They're at risk if they don't have connectivity and devices. We can't ensure that they're safe. We can't ensure that they can avoid urgent care in emergency rooms. So we have to take a huge effort to make sure that every family and youth is connected. We also want to waive any sort of processes that create more bureaucracy right now and might result in a child or a youth being unhoused or any lack of clarity about whether or not somebody is currently approved to take care of a child. So with that, we're asking for waivers of health and safety inspections for SILPs for the next 90 days. We're also asking for authorization of virtual completion of documents for youth who are re-entering foster care. So there's no face-to-face contact required. If a young person needs shelter, if they are unsafe, if they're unable to follow the shelter-in-place order because they don't have a bed to sleep in tonight, we want them to be able to immediately get back into foster care with no bureaucracy and no delay. And then also suspending annual resource family approval updates until the shelter-in-place order is lifted, unless there's a significant change or event in the family that warrants a second look. Go to the next slide, please. So I am going to turn over now back to Julie.
Thank you. And just to briefly address this point under recommendation 3, because I do think we have covered it. I know everyone is really aware of how important it is that our foster youth and our families have access to a laptop, Wi-Fi, and a telephone. And so our request is that every family, every child in foster care has access to these essential tools. They're needed now, not just for remote learning, but for telehealth appointments. We're hearing, our youth, especially right now with mental health, the need to be able to access therapists, access their caseworkers. Really important that we're not cutting off their ability to get this vital mental health and regular health care access. For visitation, as many may know, there are a variety of different suspension of visitation orders throughout the state, and sometimes only through a phone or hopefully through a video connection, are our youth able to have visitation with parents, siblings, and maintaining those vital connections to all family and loved ones. And then child and family team meetings can be held this way. And we do want to have this take place without the requirement to verify dependency status. As has been mentioned, iFoster has done a wonderful job in getting phones out. We're hopeful that with this recommendation, we can come up with creative solutions to get phones out, not just for 13 to 26-year-olds, but to every youth in foster care so that they can maintain these vital connections in all these areas that you see outlined on the slide. And then I'll turn it over to Angie Swartz at the Alliance for Children's Rights.
Hi, and so building upon or explaining a little bit more the recommendation on suspending annual resource family approval updates in order to make sure that our social workers can prioritize how to best assist families during this crisis, making sure that the social workers who are already working full-time and absorbing greater caseloads in order to respond to the crisis are able to really prioritize those activities over the coming months. And conducting these annual resource family approval updates is really not one of the essential tasks. In fact, the adoption regulations only require that the adoption home study be updated every 2 years. And so this is more rigorous, and in this time we don't want to be using anyone's time inefficiently. I would also say, expanding upon this and sort of building on this and looking at resource family approval, we also need to think about the need to make sure that we don't lose families and that we're continuing to be able to expeditiously approve our families. And so there's been additional request by many folks on this group to make sure that we are also waiving any of the non-health and safety requirements for approving resource families during this time and making sure that no one loses their emergency caregiver funding while resource family approval is pending. I think we want to make sure that as we respond to this crisis, we're thinking both short-term in terms of the actual crisis, but then also long-term, that we're not going to lose the capacity within our homes, that we're going to be able to continue to quickly approve homes coming out of this when we're expecting there may be surges to the hotline and additional need for placements of children, and then also thinking through how to continue to stabilize these placements over time and avoid having, an RFA backlog like the one that we had before. We don't want to be back in that situation as we're also coming out of this crisis. In addition, the next one was the waiving the health and safety inspections for the SILPs. That's already happened. ACL 2025 did that, but only for the youth that are displaced from a dorm. We're likely to have non-minor dependents also displaced from placements for other reasons as a result of COVID. And so we want to make sure that we can waive those SILP inspections for any of our youth who are needing to move into a SILP and needing to have access to immediate housing. So that's that one. Next slide. Also want to make sure that we are allowing procedures to be in place to virtually complete important documents so that we're not creating any barriers to young people being able to re-enter extended foster care, to being able to complete and finalize adoptions. We want to make sure that we can do electronic signatures, that you don't need to do face-to-face interviews for our resource family applicants, that we should be able to do virtual home visits, virtual interviews, again, so that we're not creating any barriers to individuals being able to be a resource family, to a non-minor being able to re-enter extended foster care, to be able to finalize adoption and create permanency for a young person. So it's important to sort of move to that virtual world while we're all having to access things electronically. And I think now I'm turning it over to Debbie Voucher.
Hello, thank you. So I am back to talk about another element related to college students in particular with experience in the foster care system. So students, as I'm sure folks probably are aware, can apply for something called the Chafee Education and Training Voucher. This is up to $5,000 per year for students who are in foster care after the age of 16 who are enrolled in a post-secondary program. And this is administered, although it's a CDSS program, it's administered by the California Student Aid Commission, CSAC. And the way that those payments currently are dispersed is through paper check rather than electronic payment. So this is different from other forms of financial aid. Most forms of financial aid do come through electronic transfers, but the Chafee payments come through paper check. And the checks are sent to the college. And then the college notifies the student that they have a check there, and the student has to physically go into the financial aid office in order to pick up their check. So financial aid offices are closed on our college campuses right now. And this means that if checks continue to be sent to the financial aid offices, students will not be able to access those resources. And of course, as we've already talked about, this is a time when students are going to need those resources more than ever. So we are urging the state to direct the California Student Aid Commission to either determine a way to disperse those funds electronically moving forward, or if that's not feasible, to issue the paper checks directly to students and mail them to their home addresses rather than directly to the campuses so that they can have quicker access to that. And for those who might be less familiar with this program, the way that it works is that the checks are dispersed throughout the year. The payments are not all made at the very beginning of the school year or even at the beginning of the term because of sort of how the waiting list process works for those funds. So even though we're well into the school year already, CSAC is continuing to issue new payments for that funding source that we want to make sure get to students. And with that, I am now going to turn it over to Simone, also with John Burton Advocates for Youth.
Thanks, Debbie. So this section focuses on youth experiencing homelessness. In California, prior to the COVID-19 outbreak, as I'm sure you all know, we had a housing crisis, we had a serious homelessness problem, and really the presence of the virus kind of obviously exacerbates things and really, increases the urgency of the need to address youth homelessness. We know that when we think of youth experiencing homelessness and youth that have been touched by the child welfare system or the juvenile justice system, these are not distinct populations. There's a significant overlap kind of in that Venn diagram between, the youth, the circle or youth of experienced homelessness, and then those other two circles of youth that have been systems involved. We know that those circles all overlap significantly. So we have a significant homeless population in California. Over the last 5 years, on average, youth have made up 10% of the homeless population when you look at the point in time count numbers. It's gone up or down over the past 5 years, but that average is 10%. And then kind of historically, when we look at investment in youth homelessness, on both the federal and state levels, we've really seen very limited investment. The last 2 years have been very encouraging. There has been state investment in youth homelessness, but kind of historically, that's not been the case. And so really, when it comes to the COVID-19 outbreak, the vast majority of youth experiencing homelessness are not sheltered, 79%, in fact. And this puts them at increased risk of contracting the virus. And then you kind of also just think about their living conditions, and they're not going to be as healthy as people who are living in a sheltered situation. So they're really very vulnerable. And then you think of those who may be sheltered, and they may be living in a congregate care living situation or a precarious living situation. And so we really want to make sure that we get youth sheltered off the street and ideally into a more longer term stable situation. Anna, if you can advance the slide. So This next recommendation is to include the needs of marginalized and disconnected youth in California's COVID-19 response. It's about creating housing for youth. It's about getting them sheltered. So kind of the first one you see there, if you on the screen, Anna, why don't we just go to the next slide and I'll talk about that one. So this has to do with existing funding. So fortunately, it requires no additional money. If we want to see the funding for the transitional housing program and the housing navigation program immediately issued, and this requires suspension of some regulatory requirements, which would be an action for the administration. We want to see a rollover of unutilized funds into the next year's budget, which would be a reallocation in the June Budget Act, and then we want to see the 2021 funding issued in July, which would be an action for the Department of Housing and Community Development. So to give people an idea of where this action would all be coming from. So in the current fiscal year, kind of the background here, the current fiscal year 1920, there was an $8 million ongoing funding included for transitional housing for youth age 18 to 24, with former foster and probation youth prioritized. And then there was a one-time $5 million included for housing navigation for youth 18 to 21, with non-minor dependents prioritized. And so this funding is being allocated to county child welfare agencies, but administered by HCD, the Housing Community, the Department of Housing and Community Development, and they worked closely with Department of Social Services on this. Unfortunately, there was a significant delay in this funding kind of getting out the door this first year. It's just now moving. I mean, the good news is that in 47 counties, we do have existing THP Plus providers that counties could have potentially immediately kind of turn around and contract with and just amend their current THP Plus contracts. But, the bad news is we're at the very kind of nearing the end of the fiscal year here by the time the funding would make it into the county's hands. And we have youth that are in need right now. So to access the funding, counties had to submit allocation acceptance forms by March 31st. And then part of the process was also to submit a signed resolution by the County Board of Supervisors for each of the two programs. Because in order for HCD to execute their standard agreements with counties and release the funding, they have to have these resolutions. That's part of state contracting regulations. So with COVID-19, as you can imagine, getting these resolutions is challenging, particularly because although HCD released this application in February, counties largely didn't become aware of the opportunity until March. So they're looking at a really short timeline, and then given all that's going on, getting that on the agenda if their supervisors are even meeting is a challenge. So the first thing we're asking here is for the governor to suspend those state contracting regulations that require the resolution so that HCD can waive this requirement and remove this barrier. So this would be an action for the administration. This isn't something HCD can do on their own. And what HCD has done that's in their control for now is they've extended the deadline for the allocation acceptance forms to April 15th. So that's really great. And are even issuing kind of further extensions for the resolutions themselves. So we're really reassured by that and working to try to get all the counties to make sure that they're aware of this funding and apply. So the second piece of this is that normally, if funding's allocated and a handful of counties don't accept their allocations, the state could turn around and potentially reallocate to other counties. In this scenario, because the funding's released so late in the year, there kind of isn't time for that reallocation. So that that means that for the transitional housing program, if funding isn't accepted by April 15th, it won't be encumbered by that June 30th deadline, and it'll revert to the state general fund. And we don't want to see that happen when there's so many, counties and so many youth in those counties that really could benefit from the supports that those dollars could produce. So fortunately, the housing navigation funds don't have to be encumbered by that date, but for THP, we're looking at not a lot, but potentially, hundreds of thousands of dollars reverting to state general funds of the $8 million instead of going to those counties. So our second ask is for any unencumbered THP funds to be reallocated in the 2021 budget for this use. And then lastly, we're just asking that in order not to have a repeat of this year, the counties can access this funding quickly to issue the next year's funding in July, and HCD has been very responsive to this request and is making some changes to make that happen.
So we've seen a lot of progress on this one, and we are working on continuing to see progress, and hopefully we'll get all three of those goals met. So Anna, if you can advance to the next slide. So this next recommendation is about this coming year's budget. We're asking that of any funding included in the 2021 budget to address homelessness, a minimum of 10% be dedicated specifically to addressing youth homelessness. So this is an approach that was taken in the last 2 years. In the there was 500, as you can see on the screen, there was $500 million put through the Homeless Emergency Aid Program. Of that $500 million, 5% was required to be put towards specifically towards youth homelessness. Every jurisdiction had that requirement. And then this current year, $650 million went through the Homeless Housing and Assistance, Homeless Housing Assistance and Prevention Program, HAP. And of that, actually 8% is required to be used to address youth homelessness. So we were very, very encouraged by this step in really in the right direction that the state was making. And so for this coming year, we're really looking for a minimum of 10%. As I mentioned, we know over the last 5 years on average, youth have made up 10% of the homeless population in California. And we know that the PIT count is an undercount. So we really look at 10% as the minimum. You know, some advocates are calling for 20%. That would be great, 15%. But we want to see a minimum of 10, and that's certainly a reasonable request. And this is a really important recommendation because having a youth set aside has been a very effective approach for investment in youth homelessness. We know that from HEAP, and we know that without a youth set aside investment in youth homelessness, dollars don't get put into it. And we look at HUD funding and how much of that gets put into youth homelessness with no youth set aside, and it's very, very small. Next slide. Thanks, Anna. So this last recommendation is really about what's happening right now. So this is an ask for $30 million of funding to go immediately to continuums of care, the homeless continuums of care. There are 43 in the state, so that they can then turn around and award that funding to existing homeless youth providers that are, ready to go, ready to serve youth, serving youth now. All the continuums of care contract with youth providers right now through the Homeless Emergency Aid Program. So just to clarify, there were some questions I know about, are you saying that this would be HEAP funding? No, we're not suggesting there's no HEAP line item in this year's budget, so that I don't even think that'd be possible. This wouldn't be HEAP funding, but it would be COVID-19 emergency funding, like the $100 million that the governor just allocated to COCs, cities, and counties for sheltering homeless individuals impacted by COVID-19. We want to see a youth version of this. So we want to see emergency funding funneled through the continuums of care that those dollars make their way to providers who are ready to serve right now to get youth off the streets, and then ultimately down the line, obviously, into more stable, longer-term housing. And you can kind of see on the screen the various needs that there are. There's the immediate needs, and then there's the longer-term needs and the support needs. And this would really allow communities to really get homeless youth impacted by COVID-19 to get their needs met, because we do have concern that, with the existing $100 million that went out, as what usually happens is kind of youth needs get superseded by kind of chronic adult homelessness. And so we really want to see some youth-specific dollars for some of this emergency assistance. So I will now pass it back over to Anna, and I think we're kind of rounding out here. Anna, are you maybe muted? We're not hearing you.
Yeah, it took me a minute to get back. People have been typing questions into the panel, onto my cell phone. I am trying to respond as fast as I can. So, and then I was like, how do I unmute myself? So thanks everyone for your questions. This is one of maybe the most questions I've ever gotten on a webinar before. This is amazing interaction. Take a moment right now to do that. And also in the control panel, if you could please take a look at this letter. What I'm asking you to do right now is, one, just send thanks to all of the presenters and advocates and folks who are working with youth right now, and audience listening in. thank you for taking some time to hear from everyone today about what's going on, to contribute your own thoughts through the comments. And I would really like to ask you all, and maybe Simone or Debbie or someone could type this link into the chat so people can easily get the sign-on link. But what we're asking you to do is to please join us in endorsing these policy solutions that you just heard. The sign-on form takes less than a minute to complete, but we are really asking for your support of foster youth during this health pandemic to make sure that our youth are safe, protected, have their rights retained during this crisis, and make it out of this pandemic on equal footing as their peers. We are responsible for children and youth who have been taken into the system, and we need many, many voices coming together during this time to form a chorus of voices for children right now. And thank you so much for moving that consideration swiftly through your organizational or individual process to be able to sign on. We do have a call set up next week with the Department of Social Services and the County Welfare Directors Association to talk about what do we need to do at the federal level to bring resources to our state to serve youth. We're going to need as many folks signed on as possible to, again, call attention and make sure that youth needs and their voices are not drowned out during this crisis by the needs of everyone else. We have to just make sure that they are heard. So thank you so much to everyone who has filled out and clicked on that link and supporting these asks. I would also invite you to, email me your asks as well.
Hey, Anna, it's Simone. So I just, what I did is I put the URL directly to you in chat. You're going to have to copy and paste that into, it won't let me send to everyone. So I think you can as the organizer.
I will do that. Thank you so much, Simone. I'm going to do that right now so that people can, oops, I think I just went away from my screen. I will do that in a minute, actually. I'm just messing up.
You can click on the chat that I gave you. You can
okay,
copy
great.
the chat that I sent you.
All right, I'll do that. The next thing that I want to go over also is just the state guidance that's come out. Many people, Diana, Jennifer, have referenced this guidance, have encouraged you all to take a look. Many of the questions in the control panel are asking where is the link to that guidance. I've linked some here on the Foster Youth Help, the Ombuds page, on the CDSS 2020 All County Letters. So you could just Google CDSS 2020 All County Letters. They're all there in one place. You can get these or use this PowerPoint. You can download it from the handout slide and get these links live right now. There's also been federal guidance, and during the Q&A, I'll have Jennifer Rodriguez from Youth Law Center give some updates on this information, but I wanted you to have a lot of the links that we're seeing so far. The Administration for Children, Youth, and Families is working to grant flexibility to human service agencies right now, the type of flexibility that we're asking for. Some of those items do need a federal waiver. Some can be done by the governor through executive order. Some might need technical fixes from the legislature. And on all of these, many people are working to make this happen as quickly as possible. So please read this guidance. There's also just a page that ACS sent out about the low or no cost technology options, that if you're trying to navigate this and can't afford to pay for a service, there are those resources. There was a town hall by Dr. Jerry Milner from the Children's Bureau did hold that. You can watch that whole video and read the town hall script. They listened to foster youth needs from across the country, and Foster Club has done a survey. So you can see the results of their survey around foster youth needs during coronavirus pandemic and shelter-in-place orders. So again, all of these links are active. If you have an issue with anything, just email me. And then finally, I also want to say that during the initial week of the pandemic, almost every single organization took time to pull resources together and get resources to young people, to caregivers, and to providers. Here are some of the links where if you're like, how do I get CalFresh application? Where is the unemployment link? How do I help a young person file their taxes between now and July 15th so that they can get their stimulus check, so that they can have direct deposit, so they can get their earned income tax credit? We've tried to put this all on here on our websites as well. I'm going to have Jennifer talk through some guidance that came out. There was a question in the panel about STRTPs, congregate care, and YLC has some new guidance around that. But please look to us, turn to us. We'll direct you to where we know, and if we can't find it, we will note it and raise it up in these conversations that we're having as a need. So please use these resources. They are here for you and for the youth that you're working with. And again, now I will turn it over for some questions. So thank you again to our whole audience here. I just want to start with Jennifer Rodriguez. If you can come in and kind of give the federal update first, and then I'll start assigning people questions.
Sure. So, well, there are many federal updates, and I would encourage everyone to read both the state guidance and also to read the federal guidance as well. There has also been recent helpful clarification around visitation of children, around court closures, around attorney responsibilities. I know many people are worried about what the long-term impact of this crisis is going to be on permanency for children and youth, and in particular reunification with birth families. So I think that's a great place to start. And for everyone to know there's additional advocacy happening with HHS to issue guidance to states around flexibility and increased resources, and that really track the kind of recommendations you're hearing here today. You can click on the YLC link and look at some of the administrative asks that have already been submitted to HHS that are specific to transition age youth, but there are a couple of other packages as well of asks currently moving forward. And then I just wanted everyone to know that today YLC and several other national advocacy organizations launched an Up Chafee campaign. You can find more information about that on our website as well, and our press release on that. But really, we are asking Congress to make a significant increase to Chafee funds. They have been around $140 million for years now. And so we're asking for a $500 million investment in Chafee, as well as waiver of education and employment eligibility criteria and extended foster care, and the ability to keep young people in foster care through the age of 22, and for some significant time, because I just want to emphasize for everyone who's listening to this, we're actually probably not talking, our asks are about 180 days after from now. But the impact of this pandemic is going to be for years. We are moving directly into an economic crisis. That economic crisis will hit our young people more than it will hit any other group, because we know there's already so little support net. So I will just direct you to the website so I don't take too much time. On the STRTP question, thank you for asking that. As I mentioned before, I think this is a population of youth that we really need to be concerned about, and doing everything possible to prevent entries into congregate care and move children out. On the YLC website, you will find a newly released emergency planning toolkit for lawyers and advocates for youth who are in congregate care. And that toolkit lists strategies for ensuring that children who are currently in congregate care are protected, and that you're taking into account health, education, social activity, family contact considerations, and also a range of strategies to move children out right now and also to be looking carefully at the licensing waivers that have been granted to facilities to make sure that youth can maintain safety, and some advocacy strategies. So I think it's, even though it's targeted at attorneys and advocates, I think it's actually helpful for everyone to look at that, because no matter whether you are somebody who just cares about a young person who's in an STRTP or a group setting or a shelter at this point, or you are a family member or a case manager, we have to do this kind of planning preventatively before it has really disastrous health consequences for our youth, who so many of them have special health needs that create vulnerability.
Thank you so much, Jennifer. Debbie, I don't know if you were able to see the questions about how can we get laptops for youth. Some of our colleges allowing students to stay on campus. If you can see those questions, would you mind just sort of going through the ones that I've assigned to you? And if you can't, just let me know and I'll read them to you.
Okay, I think I can see them. So how can we get laptops for our youth? So there are a lot of different folks working on this issue. So we at JBay have been working specifically around getting access to laptops for students in college. So if you are working with a student or students who are in college, who are foster youth, who are in need of laptops, you can reach out directly to me and I will connect you to what you need to do in order to make that request. So I'm at Debbie, D-E-B-B-I-E, at jbay.org, jbay.org. It's just like Anna's address that's up there on the screen, except Debbie instead of Anna. So that is limited, however, just to students who are in college. For K-12 students, you know, I just read that the CDE just announced $100 million for districts, and part of what they're supposed to be using those funds for is getting access to technology for their students. I am very worried about our students and whether they're going to be in the loop on that, because if the communication mechanism from school districts is to reach out to parents, it's not clear who they're going to be reaching out to for our foster youth. So I think one of the most important things you can do is connect to the student's school district and find out what they are making available and make sure that foster youth are in the mix for whatever resources might be made available through districts in the next couple of weeks. What I read is that this funding is supposed to land with the districts in the next 3 days. And so I'm hoping that we'll see by middle to late next week that the districts will start rolling out some plans for making technology available. The next question here is, are campuses allowing foster youth to remain on campus? The answer is yes, to my knowledge, and I don't have complete knowledge of all the private campuses, but all of the CSUs and UCs that have dorms have made accommodations for foster youth to be able to stay in those dorms. They've moved everybody into single rooms to minimize contact between people. So I have not heard any reports in California of any of the CSUs or UCs that have closed their dorms 100%. And then the next question, have we had a conversation with CSAC about the Chafee distribution mode and what feedback did they provide? We have been having ongoing conversations with them about that. I know that there are internal conversations happening within CSAC about that. And one of the questions that I posed to them was whether they needed any particular kind of authorization from the state in order to shift their payment mechanism. I have not received a response to that yet. So we are continuing to try to get information from CSAC about what's happening internally around this and what would be required to move that change forward.
Thank you so much, Debbie. Diana, I have assigned a number of questions to you. I don't know if you're able to see them and kind of read through them or go over them, or if you'd like me to read them to you and have you answer.
Oh, they just came through quickly. Sorry, I've been checking and I didn't recently. So do you want me to read them, Anna, and respond?
Yeah, would that be okay?
Or, okay, I can't read the first unanswered question. Could you?
Okay, so let me go down to the ones that you haven't answered yet. So one of the questions is what are the primary mechanisms for informing youth about the resource options and how to access them? Aside from I did post the resource pages on that previous slide that everyone can access and share those. But Diana, from your perspective, what's the best way to get information out to young people right now?
It really is through their social worker, and we are sharing resources with all 58 counties as we get them. So the information we're getting from today's webinar, the information about the foster care ombudsman being open 7 days a week, we just package that up. We have a transition age youth subcommittee that includes the IOP coordinators and extended foster care managers and many other staff, as well as our child welfare directors. So we have a couple of email distribution lists, and we send broadly, and we can also add these items to our own CWDA COVID-related website.
I was on mute. Thank you, Diana. Another question was, and maybe you don't know this, but the question was, has anyone reached out to Amazon about providing supplemental packages to everyone on CalFresh, or any sort of private-public partnerships that you're hearing about?
That's a great suggestion. I think I'd have to bring that back to the state, because I think the state really has that power to leverage those resources on behalf of the consumers we serve. And it's not just in child welfare, it is on the older adult side as well as our CalFresh and CalWorks recipients. So a great idea. I'll reach back out to the state to see if they could put something in motion.
Okay, thank you. Let's go down to the next one. I'm just sort of scrolling down. So one question is, can a process be created where masks are collected? That way they can specifically be handed out to foster youth and resource family homes, and including those foster youth who have recently aged out. So I know you mentioned personal protective equipment. Is this something that people are working on, or how could volunteers get connected?
This is an area of great challenge for all of us, right? So we hear on the news that healthcare workers don't have enough, our social workers don't have enough. We know resource families and youth have that need, especially given the more recent update issued by the governor that recommends that, generally having masks is better protection than having no mask. We advocate, so counties advocate with our local Office of Emergency Services for any personal protective equipment, which generally includes masks, goggles, gowns, and gloves. Those are the 4 big categories. Those are all in short supply, unfortunately, and counties are struggling. We're struggling to get our own staff those supplies. So we've asked the state to talk to state OES to say, can we be a higher priority, just at least for our social workers, and then as well as for any caregivers, especially if they're going to be caring for someone who needs to be, it may have been exposed and may be ill. So I think the more that we can say that together in unison, the better, because we're basically all competing for limited supplies.
Thanks. So that might be something that I think that question was from Layla. So if we find information, again, we will post it. We will send that out and update it on our COVID resources web pages. The next question then, I'm just scrolling down. I'm seeing if there's any more for Diana. Diana, there was... Okay, you want to just go ahead? I think you made it before I did.
Any thought given to connecting youth with new employment, such as Amazon grocery stores, Walmart, etc. Also a great idea. I'm certainly happy to pass it on, because I think that could be a great resource. I do know that iFoster has a program, and I'm assuming it's still happening, where they partner with grocery stores and outlets to provide jobs, and they also provide training to youth. So iFoster is another resource that already has a program up and running. and any youth can contact iFoster directly.
The iFoster link is on our COVID-19 resources page. If anyone's having a problem, use that link in the PowerPoint and or email me and I'll send it to you. Anything else that you're seeing, Diana? There was one clarifying question, I think, on the, I think I haven't assigned the rest of them. So I might, oh, there's someone on that says, I work for iFoster. So if the person who works for iFoster can send me any link, I will, in the chat, I will post it to the whole group right now. Diana, there was a question about, you mentioned there's been a drop in referrals from 1,000 a day to 400 a day because they're, the mandated reporters and schools and everything is sort of shut down right now and children are at home. So I think there was maybe confusion between a drop in referrals being different from the total call volume. So that those referrals might be shifting to other hotlines or calls. And can you just make a clarifying statement on that?
All right. So it really is a drop in calls to our child welfare hotlines that are dropping. Once that call comes in, it is evaluated to determine whether an in-person response is warranted or not. In California, we separate it by three, if you will. So they'll either be screened in as an immediate response, which under California regulations is within 24 hours, but most counties treat that within 2 hours. They'll go out very quickly. Others may be what's called 10-day responses. So we have up to 10 days to respond. And then others may be evaluated out. Evaluated out is simply, the call didn't relate to abuse. It might have been like they're actually just asking for information on how to get a service, for example. It's not to report abuse or neglect. So those are the categories, and those are calls to the hotline that folks are seeing that have gone down nationwide, not just in California.
Thank you, Diana, for sharing that. I was wondering if Erica, if we can go through your questions, if you're able to see them and read them off.
Yes, just give me a second. I answered them. Let's see, I have a few. A lot of them are about the shelter that I mentioned. Just to clarify, the shelters that are open right now for young people, they are opening earlier. So they're used to opening at 8 p.m. for beds, but now they are opening at 4 p.m. Usually because screening takes a while. But young people are being funneled to different shelters because not all of them are opened currently in the Bay Area, or taking new people in because they don't have the means to properly screen people and detect for COVID, and they don't want to spread that to other people in the shelters. Yeah, the vacant, I missed what the program was. Yeah, it was Shelter in Berkeley. And then someone else said that too. What option do you suggest for mentors who mentor foster youth? This is a broad question for me. Formerly being a case manager or a youth peer advocate, I would highly suggest maintaining communication with the young people that you serve for as long as you can, because I understand a lot of them, sometimes they have phones that are shut off, but they go somewhere to find Wi-Fi, but they can't go to Starbucks anymore. They can't go to the library to get Wi-Fi anymore, so they can't contact you as much. And they can't go to their friend's house because everyone's on lockdown. So the best thing for that, I would highly suggest, if you can get a hold of them and actually talk to them, ask them what their needs are right now. This is more so stated needs, not what we feel are best interest needs, and just focusing on what they really need right now, which is more than likely going to be food. And if we as mentors are able to provide them those non-perishable items that were really beneficial to the young people in the Bay Area that did those food bag runs. And then also just having a heart-to-heart, checking in on them and seeing how this is actually affecting them right now. Because if you are a mentor who mentors a foster youth, more than likely they're going to share something with you that they probably won't share with other people, nor will they have the access to contact other people. So if you could really take the time that they've given you and that you've given them to really ask those specific questions. I have another one. Since social distancing can cause foster youth who have already been exposed to trauma to be shocked right now, resulting in areas where healing was once in place, for there now to be a huge discomfort with self and life in general. This is a true concern when it comes to those youth who have the tendency to be introverts. So is there a place where foster youth can go and post general questions and get weekly answers? I'm going to throw this back to the group to see if there's anything like that. I feel like that was posted for the California Coalition of Youth in the chat for everyone to see, but just in case, so I'm not missing that, if anyone else wants to bump in there and answer that question.
Yeah, I put that in the chat. That was from the California Coalition for Youth, just wanting to share that shelter information and their hours with everybody that's on the call. So thank you, Erica. Were there any other questions for you? I think that might have been all of them.
One more.
Okay, so oh, go ahead.
There was a clarifying question for the foster youth mentor. Is the mentor able to still do mentoring by moving to telephone weekly mentoring options, or is there something else in place? The young people that youth peer advocates are working with, the Spark initiative in the Bay Area, they are moving to telecommunication. Usually they used to do face-to-face conversations and meetings, but obviously that can't happen right now. So they are working with the young people that they're able to still stay in contact with via telephone and checking in with them to make sure that their needs are met. Obviously, when I talked about the food bags, dropping off the food bags, they drop it off at their place. There is no actual contact. They just let them know hey, I got this food bag, just to clarify that the drop was successful, and just continuing to reach out. So communication is really critical for them, but for the young people that they meet with on the streets, when they do street outreach, it's hard because they can't really get a hold of them if they can't actually see them. So that's another issue too that I wanted to mention, but I hope that answers your question.
Thank you so much, Erica. I'm going to answer a couple of questions, and then Julie, I'm going to have you answer some about non-minor dependents that were tagged for you. Amanda Kirshner asked a question about the concept and recommendation of increasing the foster care payments, the non-minor dependent payments by $400, the SIL payments, the infant supplement, and the drawdown from the feds. And so I guess what I would encourage Amanda is I'm happy to reach out to you and share sort of the budget calculations that we've done on that, on what that would cost with the state share and the federal share coming out to a total of $400 rather than $800. And that would be per month, again, to sort of weather the storm and get through all of those additional costs that Jen Rexrow brought up during the discussion earlier. So again, I would just say let's have a conversation with the details. And there's a couple of questions in here that some have to pertain to the sign-on letter. About a deadline. There's no deadline for the sign-on letter, although many of the decisions and actions around needing an executive order, needing guidance, we've had really excellent responses. You heard Diana from CWDA on, very active. Everyone's moving quickly. The Ombuds office has opened up 7 days a week. Everyone's being really responsive. CDSS had a number of updates to give us when they checked in, and like I mentioned, we're talking at the federal level. So there's no deadline to signing on to this letter, but we will need that support for when we do need technical legislative fixes or a budget, a way to ask that the stimulus money be directed to foster youth. We will need that. So as soon as you can move that support through your processes and get signed on, the better. because these decisions have to be made quickly. It is an emergency, and we do need your help in lifting those up. Another question that was asked was just about what is the timeline on this? I think there's ranging timelines. Like some of these things, people are having active ongoing conversations, and things might happen through a new guidance letter next week. It might happen through executive order in the next wave that the governor puts through. And some might need more time to figure out how it happens. So I'll just say that, and we will absolutely keep people up to date. There is a website on our page where that's all about these policy recommendations related to coronavirus. And if you follow that website or reach out with questions, we will answer those. Julie, do you want to take some time to answer your questions?
Sure. I will do the best I can. I'm not sure I have answers to every one I've seen here, but let's give it a shot. And obviously anyone else on the panel who has answers, I welcome them. The first question is, are non-minor dependents in a foster home placement eligible for a stimulus check? This one I'm going to say, I'm not sure. My understanding of the stimulus check is if you're not being claimed as a dependent by someone else, you should be eligible for that stimulus check. So I would assume non-minor dependents, unless they are being claimed as a dependent by someone, would be eligible. Once again, if anybody else has other information, happy to hear it. Sorry, I'm trying to figure out the question mode on here. Okay, it looks like the next one is, will the moratorium on discharge apply to youth who are not in compliance before the pandemic? I'm trying to see who asked that question. I'm not exact. So if you're asking if youth can be exited from foster care right now because they weren't in compliance beforehand, I think we're asking that a housing first model approach be applied across the board. I don't think we want to see any youth exited out at this time and placed into an unstable situation. Also, I know at least in LA County, and I believe in other counties, there aren't actual hearings taking place to terminate youth from jurisdiction. So that is a court process that would need to happen. So I would believe that we'd be asking for this moratorium to apply to all youth currently in foster care, as we want them to remain safe at home, as the orders have been issued from the governor and many of our local mayors.
Thank you, Julie.
Hold on, there might be.
I think there's a few more. One is about how many youth in California are having placement disruptions as a result of COVID-19.
Right, I did see that one, and I do not have that information. I don't know if anyone has that. What we have are, our attorneys reaching out to us. We just got an email for youth who are being asked to exit placements for a variety of reasons. So we're addressing those on a case-by-case basis, but I don't have, at least right in front of me now, it's a number we can probably, in talking to others, come up with, but I don't have that number. Sorry, Anna, is there another question?
Nope, that's okay. No, I think, well, I might come back to you, Julie, if I see more, but I think the next question is for Angie. If Angie, you're still on. The question is, if a non-minor dependent moves, how have counties been conducting SILP home checks during this time?
Well, right now the ACL that was released only provides the ability to waive the SILP inspections for youth that are displaced by college, if you read it literally. And so what we're asking for as part of our recommendations is to extend that same ability to any youth that needs to move into a SILP right now. You'd have to ask Diana if she knows exactly how it's occurring at this moment, but in terms of just the reading of the language in the ACL, it's limited to the youth that are displaced, and so we're trying to expand that so that all of the youth can be quickly housed again.
And this is
Thank
Diana.
you. Diana, are you on?
Oh, sorry. Can you hear me?
Yep, sorry, go ahead.
Okay. Yeah, we would like to see that flexibility as well. These should be, video conferences if they need to happen, or waive them in the meantime. Whatever flexibility we can get, so we're not creating, additional in-person contacts that, risk everybody's safety. So we, how counties are doing it, I'm sure they're trying to make it work within whatever they can do right now, but we're hoping for some guidance from the state to give us some flexibility in this area.
Thank you, Diana. Jennifer, I know that you had a number of, I think, sort of a three-part question that was assigned to you. I don't know if you're still on. And while you kind of unmute yourself, Carolyn Grace Murr asked, can you post the link to the sign-on letter? And I have done that in the chat panel, and it is also on our JBay website.
So this is Jennifer, and to tackle my questions here looks like a four-part question. Gonna make me work for this question. So the question was, is there anything that is currently being done to keep youth from exiting foster care during this time? And for youth who have left care prior to COVID, are they able to receive extended care? Let me take those first two questions together and say that absolutely. I think it's important for everyone to know there are not any decreased entitlements to benefits for young people in the law. Now, access is an issue, but youth who exited foster care prior to this crisis, who need to re-enter into extended foster care, are fully eligible. And we are hoping that at a county and court and agency level, that people are already taking action to implement some of these recommendations and make the process for re-entering as easy and free of sort of need to fill out paperwork and contact staff as humanly possible. But yes, youth can and should re-enter in now to have those protections. And as far as if anything is being done to keep youth from leaving care at this time, we'll say that Children's Counsel, Children's Attorney, we have Children's Law Center here on this webcast. I think a lot of attorneys, even despite court closures, are doing a lot of advocacy to make sure that their clients, that youth are not exiting from foster care right now unless the youth wants to, and they have a housing plan and a transition plan in place that will keep them safe. So there is a lot of advocacy that our lawyers can do, and I think right now children's lawyers are more important than ever, because as agencies have so much pressure on them and are dealing with either currently impacted workforces or soon to be impacted workforces, that we need children's lawyers to really be stepping up. And I think in many parts of the state, they are in fact working to ensure that youth are not exiting care when they don't need to. And then on question 3 here, which is what are judges doing to get youth back home with their family? I'm going to say it is less judges at this point and more lawyers. So there are some best practices. If folks are interested in hearing more about court and the legal perspective, yesterday we did a webcast with the American Bar Association, Children's Rights Litigation Committee, and the National Association of Counsel for Children that is up on the NACC and ABA website now. That is completely about the judicial response and the legal response and what some of the advocacy strategies are. And right now, the bottom line is that I think lawyers are really pushing for the same kind of good practice that we've always wanted. So an example was shared on that webcast by another presenter of advocates working with a family finding and engagement agency in Pittsburgh, Pennsylvania, where they have heightened and ramped up sort of crisis response to ensure that all youth who can be returned to their biological family, like if their reunification plan was they were going to move in a couple of months, to expedite that, or to make sure youth can go on an extended home visit if that is safe and that's where youth want to go, and to really locate other extended family members if reunification isn't an option. So that's something lawyers can take the lead on. And then the fourth question here about what is happening to support youth who are in STRTPs, just want to redirect back to that advocacy resource. I am hoping that social workers and lawyers and advocates are working really, really hard to get as many youth as possible out of group settings because of the health risks right now. And if a youth needs to stay in an STRTP because there is no other alternative, that the protection sort of plan can be used in there to ensure that that youth is able to get their needs met. But right now, the reality is that the very reasons that youth might have been in STRTPs to receive a particular intervention or treatment program are actually not possible in this crisis. So it really requires, on a case-by-case basis, revisiting. And then last question here is, how can we couple increased technology with education and support for youth and caregivers to use technology safely, including avoiding grooming for trafficking and exploitation online? I think this is a great question, and there's actually a lot of guidance online about how families can do that. And there's nothing that I think is special about our children and youth sort of needing to know the same online safety that all children need to do. And this is a really important time. I think while children are in families, are supported, are under 18, to be teaching them those strategies, because as you know, there's a digital record of everything, and mistakes can escalate into sort of huge, huge incidents. So this is something that I hope everyone will take mutual responsibility for: children's lawyers, case managers, resource families, mentors for youth. Is if this is the first time that a child or youth is having access to the online world, I mean, it just is here. It's just like teaching your children how to be safe if they're walking down the street. It's the same idea with online. It's no longer an option, it's a necessity. And so there's a ton of great resources that are out there to help with that.
Thank you so much, Jennifer. Was that all of your questions?
Looks like it, unless I missed anything.
I don't think so. I think I was tracking. So Diana, I just tagged you in a few more questions. And while you take a look at those, I just wanted to say there were a few more questions about, is the sign on to the letter link active? It is. If you're having any issues signing on or activating that link, just email me. My email is right here on the slide, and I'll send it to you right after this is done. And then Diana, if you're able to kind of go through a few more of these specific questions, that would be great.
Okay, in 2 minutes, got it. Any recommendations for virtual visits for Vaio parents and resource parents for their weekly visits? Gosh, so nothing directly. I would just direct you to your county social worker. All counties have established some way of doing these virtually. I've heard a lot of FaceTiming, Skyping, Zooming, although there's some increased concerns around security breaches for that. But they definitely have various counties that are using different tools there. So speaking of shelters, are all of the counties supposed to have a transitional shelter center for, I don't remember what TSC stands for exactly, but for non-minor dependents? If a county doesn't, can something be done to encourage a county to open such a shelter? It would be better than a regular adult shelter. So we're prioritizing, and as Jennifer Rodriguez mentioned, there's a placement preservation all county letter. I mean, to the extent we can maintain and encourage home-based placements, that's really where our focus will and continue to be. That said, there may be some opportunities for accessing some of the homelessness funds and supports for this population. So I think to be continued on that. The next question, being that school is out and children are spending a lot more time in the home and kids are eating more in the home, can foster parents that require more food apply for CalFresh? And if so, how do they apply? I would say contact your county CalFresh program to determine your eligibility for that program. The next question, might a place say that youth could go to ask for help could be the ILP office. This sounds like a statement that youth, if they need assistance, could go to their ILP office. Certainly, I would continue to encourage youth to contact their social worker or ILP worker. Offices aren't really open, so everyone's generally working remotely now. And then I think this is my last question. What is happening for youth that are turning 18? Are they remaining in their foster homes or are they being moved into a SILP? Well, hopefully they're staying in the extended foster care program. That would be our goal and our desire. So if they're not, then certainly, they will need some housing supports. And again, I would recommend that they still talk to their social worker about ensuring that they have a transition plan to ensure their housing continues to be stable. And I will say that I and many of the folks on this call, my fellow presenters, we are all advocating together for continued housing supports and meeting basic needs for our families and our youth. We're appealing to the federal government. We're appealing at the state level. We're certainly working on your behalf. Please continue to send us your needs, your issues, your questions, because they, in that way, inform us of how we should advocate.
Well, thank you so much to everyone. We are now at 12:01 and our session and the Child Welfare Policy Roundtable time is over. It's time for everyone to have a rest, a stretch, a bathroom break, a lunch break. But I want to first thank all of our panelists. The second, thank our audience for all of your questions and for letting us know what your questions are and how we can provide this information. Please check out our resources page, the state and federal guidance that's in this PowerPoint. And again, please consider signing on to the letter of support. If you have any questions about this, please let me know. I will try to have all of this posted on the JBay website in our training archive by the end of the day today, so you should be able to access it and get all of the materials there, share with anyone who missed today's webinar. And you'll be hearing from us more about opportunities to advance these policy recommendations and what more support is needed when the time comes. So big round of applause to everyone. Stay safe, follow the directions from CDC to the best that you can, and reach out for help when you need it, because we are here for you. Thank you.